I'm now going to do a demonstration of the needle technique that I use on distal points that I was taught by my teacher, Dr. Jiang. Dr. Jiang emphasized that one should be gentle with one's patients. She said that many people are frightened to come for acupuncture because of the pain which it causes. And she taught me this technique which would to cause a minimum amount of pain. She also explained to me the difference between tonifying and dispersing, or reinforcing and draining, as it's sometimes taught. She explains that although the texts say that you should rotate clockwise to tonify and rotate anti-clockwise to disperse, and although they say that you should use a vigorous movement to disperse and a gentle movement to tonify, she said it's what actually happens is the important thing. It's not simply the intention, it's what actually happens. And very frequently you can find out what's happening by asking the patients. And so what I'm going to show here is, first of all, tonifying the point bladder 23, and secondly, dispersing the point liver 3. I've chosen these 2 points because they're commonly used for treating eye conditions. So there are 2 ways of inserting the needle. One is with the tube, which you can do the conventional way, which is like this, to get through the skin layer. Or alternatively, you can just insert the needle like very, very quickly, like that. And then you go down to the correct depth and you ask the patient what they experience. Can you feel anything now?
It's a nice warm feeling.
A nice warm feeling. And in order to get this nice warm feeling, the needle movement is small and slow, and the rotation is less than 180 degrees. So you can see this is, when you do this, the patient experiences the nice warm feeling, which is the qi actually flowing into them and building up their qi. And then normally we'll leave the needle in for about a quarter of an hour, 15 minutes, I'll normally leave it in. I'm not entirely sure whether the needles really need to be left in, but what I'm quite sure about is the patients need to lie very still and very calm after you have tonified for the full benefit of the tonification to take place. Just in the same way that it's a good idea to be quite calm after a good meal. So they need to be very still and calm, and the best way of ensuring that they do this is to leave them with the needles in. So I'm now going to needle liver 3. I'm going to do the insertion this time with a tube. So, okay, so locate the point, insert it, and go down to the required depth. Can you tell me what you experience?
It's numb, slightly distending feeling.
Right. So now we've obtained the qi. Some patients you need to move up and down very vigorously in order to get the dispersing technique. They should feel something which has discomfort in it. It shouldn't be excruciating pain, but normally there is some discomfort. So in order to do this, we gradually increase it and we say, can you tell me what you feel?
It's a numb ache.
Now can you tell me what else you feel?
Oh, going right down into my toes. It's uncomfortable going into my feet.
So you can see all I had to do with this patient was a relatively mild dispersing technique. Some patients, big strong patients with a lot of stagnation of qi, you need to have a much more vigorous up and down movement in order to disperse the qi. In this patient, it was relatively mild movement, was enough to disperse the qi. But the key thing is what the patient experiences, is what actually happens to the qi in the patient. And this is why it's very beneficial to ask them, what do you feel, what do you experience when I'm doing this?